Hi, I'm Cher Harris, General Manager of the Houstonian Club. When we started to see the cases rising in other parts of the world, we reached out to colleagues of ours in the club industry, not only from the United States, from around the world, to find out what they were doing. China was already opening some of their clubs, so we wanted to find out the best practices. We wanted to find out vendors, where we could order supplies, temperature scanners, plexiglass, etc., and what we really needed to do to reopen safely.
I'm Dr. Ed Septimus. I'm an infectious disease physician here in Houston and on the faculty at Harvard Medical School and Texas A&M. Well, the team here was wonderful to work with. We actually began to meet on a regular basis, starting to go through department by department to make sure that every area of the club would be safe when we reopened. We created a manual that was over 20 pages that really was overseeing everything within the facility to make sure we hadn't missed anything.
Well, employees were so excited to come back. They were ready to greet our members again, to our safe environment here, stress-free environment, and it was important for us to make sure that they felt safe before we brought the members back. And I think we achieved that. I think our employees were really comfortable with all the steps that we put into place. With obviously all of our employees wore masks and PPE from the beginning. We had plexiglass shields. We made sure that their environment was safe.
Well, the first thing we wanted to do, we wanted to open it up safely based on the best available science and recommendations. So we gradually worked through one step at a time. One, we needed to screen members who come into the facility. We needed to make sure they masked. We wanted to make sure that they washed their hands before they came into the facility. We also went up to the exercise areas and wanted to make sure we spaced the exercise equipment out far enough so we could maintain social distancing during the whole time they were in the facility. We also talked to engineering, because we wanted to make sure we had adequate air circulation within the club. So we increased the number of air circulations plus the amount of outside air that was present in the club and made sure the direction of the air was from top to down. All that was very important as baseline to opening the club safely. And as new guidance became available or new science became available, we wanted to implement that immediately so that we would be on the leading edge of safety. So most of the changes that we've recommended since we've opened have really been implemented within a week. Well, I think the science is clear that physical activity improves not just your physical well-being, it's also important for our mental well-being. During times of shelter in place and stay at home, people feel isolated. They're not getting the exercise they need. They lose their stamina and they lose their endurance. And so regular exercise is really important for both physical and mental well-being, and keeping clubs like this open, I think, is very important. So as when I think about the club, I think about all of us doing our share. That means everyone wearing masks, everyone social distancing, everybody washing their hands, disinfecting the equipment. If we all do these things consistently well, we can make this a safe experience for both members and for our employees.
Well, we wanted to thank our members first and foremost for their support during our closure and then with our reopening. We know things are changing on a daily basis, and we're trying to update you as much as possible. So thank you so much for sticking with us, and thank you for wearing your masks. I'll see you at the club.
Now back to work.